Hi everyone, my name is Beatrice and welcome to my channel. And today I'm going to be discussing a typical day in an NHS medical ward. If you work in a medical ward or you're going to be working in a medical ward, most likely you'll be admitting your patients from the emergency department or places like emergency assessment units, or you might be admitting patients also from other medical wards, maybe due to the request of the bed managers, or you might be admitting outliers from stroke ward or other wards that have medical outliers. What are the common diseases or diagnoses that you can find in a medical ward? Diagnoses such as ischemic heart disease or cardiac diseases, diabetes, cardiovascular accidents, COPD, sepsis, alcohol and drug misuse or complication of drug and alcohol misuse, and dementia and delirium. So let's start the day. A typical long day shift starts at 7:30. Coordinator of the previous shift is going to give a handover or a general handover. The general handover is going to consist of patients for resuscitation, patients that are very sick or very unwell, or patients that might be wandering that needs one-to-one care, patients that are for discharge or admissions that we might be expecting in the new shift, or patients that are for transfer. The coordinator might also talk about the staffing levels and if consent for the staffing level for the new shift needs to be raised with the supervisor or the line manager or the matron. Depending on the ward and how it runs, the coordinator of the old shift or the coordinator of the new shift might be the one to do the sharing of the patients among the staff. Then after the general handover, a specific handover will be done. So each nurse will go to their base and collect a specific handover from the nurse that looked after the patient in the previous shift. And so do the carers or the clinical support workers. They also collect specific handovers from each other. Depending on how well staffed that shift is, people that are usually present in a general handover include the nurses, the carers, the discharge coordinator, if there is one present that day, the housekeeper, and the ward clerk. Usually, the general handover and the specific handover should be done between 7:30 and 8 o'clock. Sometimes it does spill into past 8 or 15 minutes past 8, depending on how very unwell the patients are. So once the specific handover is done, medications should start immediately between 8 o'clock and 10 o'clock. So I don't know of other wards or other trusts, but in my trust, if you don't give a medication by 10 o'clock or before 10 o'clock, once it's 10 o'clock or past 10, the computer is going to raise an alarm and ask you, why are you administering this medication late? And you really don't want that to be given an excuse, or I administered the medication late because of something, or except maybe the patient was sleeping or the patient refused the medication at that particular time and wants it now. But most likely, just try to do your medication in between 8 o'clock and 10 o'clock. Again, I guess this varies from trust to trust, but I'm telling you this based on my own trust. And also, while you're administering your medication, try to prioritize things they call time critical medications. So things like insulin or Parkinson's medication and antibiotics should always come first out of all your medication, especially for things like Parkinson's medication. You don't want to be delaying those kind of things. So while the nurses are administering meds between 8 and 10 o'clock, the carers and the housekeepers have already started serving breakfast to the patients. So after breakfast has been served, most likely the carers will start helping out with the washes, and when the nurse is also done with the medication, you also go ahead and assist the carer with the washes. Depending on your ward, but in my ward, by 11 o'clock, we do our board round or our multidisciplinary team meeting. So some wards have it by 10, 11, just depending on the timing. So by 11, we gather around, we discuss each patient, and we talk about what's the way forward and how can we move this patient out of the hospital and towards their discharge. In the board round, you most likely will see a doctor, an occupational therapist, a physiotherapist, a social worker, a discharge licensed nurse, a discharge coordinator, nurses, and pharmacists. Also, depending on whether services of other healthcare members might be needed, you might see them from time to time in the board round. After the board round, most likely you would want to start doing your vital signs and checking blood sugars. And by 12 o'clock, lunch is served. So most of this information I'm giving is based on the trust I currently work. It might vary from trust to trust, but at least this gives you an idea of how a medical ward in the NHS runs. So lunch is served by 12 and we give the lunch to every patient. And then by 1 o'clock, you start serving afternoon medications. For breaks, everyone is entitled to 1 hour break, but you can't most likely take the 1 hour break at once. So it's usually broken down into 15 minutes and 45 minutes or 30 minutes and 30 minutes. So you might take 15 minutes in the morning and then 45 minutes later in the afternoon, or 30 minutes in the morning and 30 minutes in the afternoon, depending on your choice and when you want to have it. By 3 o'clock, we have something called the safety huddle. The safety huddle is just to check how each member of the MDT team is faring. Well, mostly nurses and carers are usually the ones available for the safety huddle, but you just ask, oh, how each member is faring, have you taken your break, do you need help with anything, are you struggling with any patients, is there anything that the coordinator of the shift should be aware of and should get ready and prepare for. So that's what mainly safety huddle is about. By 5 o'clock, you want to start doing the blood sugars again, like the evening blood sugars for your patients. Somewhere in between this whole period, you also want to be checking the doctor's plans, you want to check their updates, you want to know have they asked you to do anything, and you most likely see it in their notes. In between this period, you'll be carrying out wound dressings for patients that have wounds and need dressings. You might have to give IV fluid, you'll be giving commode, bedpan, depending on the ward you are working. You'll be inserting catheter, doing bladder scan, giving oxygen, or taking care of tracheostomies, or carrying out bloods, or doing cannulation. By 6 o'clock in the evening or 1800, you want to start doing your evening meds. And then by 7:30, you are handing over to the evening nurse. So for night shifts also last for 12.5 hours, and night shifts start at 7:30 in the evening or 19:30. The general and specific handover should happen or take place between 7:30 and 8 o'clock. By 8 o'clock, you want to start doing your vital signs, carry out your BMs for any patient that might be diabetic, and then start administering your medications. Most likely for a night shift, you might finish giving your meds by 10 o'clock, 11 o'clock, or at most 12 o'clock, depending on how unwell your patients are. And by 11, 12, we expect that the patient starts sleeping and have a good night's sleep. In between the night shifts, you'll be giving out commode and changing pads and giving bedpans. You might also have to do night charts. So night charts are just things to, say the behavior of the patient. Let me give an example. A patient is supposed to be discharged home, but this patient is going to be discharged home with package of care. Now, package of care just simply means carers are going to come into the home to take care of the patients and help the patients with activities of daily living. Now, these carers are not going to be around in the night. They only come in the daytime. The multidisciplinary team will want to know, what are the needs of the patients in the night? Can the patient go to the toilet by him or herself in the night? Or does he or she need help with things like peeing or using a commode or bedpan? So a night chart is just going to document that. So at every hour, you write whether the patient is sleeping, did the patient need a commode, did the patient get out or use it by themselves, or did they need help, or the patient wandering, and things like that. That way, when the multidisciplinary team comes the next day, they can have a look at the night chart and see, oh, the package of care is going to be okay for the patient, or these patients might need to go to a care home. In between the nights, you might be having admissions, you might be having transfers. If you have a very unwell patient, definitely your night is going to be very busy. You might be doing things like ECG, carrying bloods, giving IV fluids, administering meds, following your patient down for an investigation if they're on oxygen. Also in the nights, we do things called night checks. So part of the night checks includes CD checks, where 2 nurses go to the treatment room or the medication room and check the CDs, make sure that they are the right amount and none is missing. And also, if they need to order new ones, the night nurses will order it in the CD book, and then when the day nurses come in the morning, they send it down to the pharmacy. We also do things called the treatment room temperature check. So there's a thermometer in the treatment room or the medication room that checks the temperature of the room, just to make sure that the temperature is okay for the medications that are there. Do things called the fridge check, where we check the temperature of the fridge. So inside the fridge, you see things like insulin or some subcutaneous injection or some fluids that needs to be refrigerated. So just to make sure that the temperature of the fridge is the right temperature for those drugs to be stored. We also do things called hypobox check. The hypobox is just a box that contains things that will be used when a patient goes into hypoglycemia. So you just want to make sure that the box is sealed and everything that needs to be there is there. There's also the crash trolley check. The crash trolley is what's used for resuscitation. You want to make sure that everything that would be used in the case of an emergency is there and nothing is left out. In the night also, every nurse takes their break. The break is also 1 hour. I just want to say that 1 hour break is unpaid for. So the NHS doesn't pay you, or your employer doesn't pay you for your break. If you didn't know that, now you know. By 5:30 in the morning, we begin vital signs, we begin blood sugars, and we start administering meds. The night nurse is supposed to help the day nurses do their IVs or any NG tube medication or any PEG tube medication. The night nurse is expected to help with that, and you can also pick like 1 or 2 patients and do all their meds. So it's easier for the day nurse when they come over. The carers or the CSWs just simply means clinical support workers, also help the day staff with some of the washes. They might do like a few washes here and there just to help the day staff, because the truth is that the day shift is usually very busy than the night shift. The night shift can also be busy, but usually not as busy as the day shift is. And then by 7:30 in the morning, the night staff should be handing over to the day staff.